I'm going to share a story that I've thought about sharing a gazillion times since I've been on social media. I think today's the day. So I was in medical school from 1996 to 2000. When I was in my third year OB rotation, back then, all the patients delivered in the OR. Vaginal delivery, C-sections, they all delivered in the OR. And I remember going back for a delivery, Black patient. This was her fourth or fifth delivery. Delivered seamlessly, not an issue. And I remember it was me, the faculty, and a resident. Don't remember what year the resident was, doesn't really matter. But after the patient delivered, the faculty looked at the resident and said, "Have you repaired a 4th degree laceration yet?" And the resident said no. So, hold on. So, the faculty got a pair of scissors. Okay, the faculty got a pair of scissors and he put one blade in the vagina and one blade in the rectum, and he cut a 4th degree in a patient who had already delivered. Now, I was a medical student. I didn't know if that was what was done and that's how they trained residents. I don't even think it even computed with me what was happening and how wrong it was, obviously, until I got more training and became a resident myself and realized what had actually happened. There's a lot of things that happened back then that we were made a party to because of the practices and obstetric abuses that were commonplace, and we couldn't say anything. We couldn't say anything. And although I will never know what it's like to be a Black pregnant individual in this country, I can educate myself and understand and teach and learn some more and bring awareness and do better as a physician and as someone who's teaching future physicians. So in many ways, I do treat my Black patients differently because of what I know and I have learned. I have not experienced, but what I know and what I have learned has happened to them in healthcare since Joe Marion Sims. I make an active effort to make any situation I'm in a safe place for my Black patients because I care and I try to learn from them. And they actually teach me. But I can't be taught if I don't ask. So I ask. The fact remains that the reason why Black patients in this country have the highest rates of maternal morbidity and mortality are largely due to racism, both within the individual providers and with the systems. It's not because of any biological differences in their bodies or their anatomy or their physiology. It's due to the fact that when they hit the door, they're not set up to receive equal and equitable health care because of the tone of their skin. And if you don't believe that, just hear this one little fact. Black pregnant patients with a college education still have a 5-fold increased risk of maternal morbidity and mortality over their white counterparts. So if you are an obstetrical care provider or you're becoming one, we just had match week, make sure, if you need it, educate yourself. Learn, talk to your patients, read, follow accounts that are educating on this topic if you're on social media. There are plenty of ways that we can arm ourselves to better take care of our Black patients. And with everything that's going on politically in this country, the risk to them is even greater.